Hello, my name's Mark, and I'd like to talk with you about healthcare, about our healthcare, about American healthcare, about healthcare that ought to be of the people, by the people, and for the people, and how we can make it that way. Now, this is a stethoscope. It's used to listen closely to the subtle sounds of the human body which the ear cannot detect on its own. The stethoscope has been viewed in the past as the tool and the sign of a doctor, but not so much anymore. Many other medical professionals use them for the same purposes as physicians. I'm wearing it as I speak to you about healthcare because I want you to remember my perspective as you hear my thoughts and ideas. I am a physician, and as such, it is my duty and my privilege to help individuals face the challenges of obtaining and maintaining their health. I also want you to remember that this is how close I am when I listen to real people express their joy and their sadness, their hopes and their fears, their successes and their frustrations, appreciate the benefits, and struggle with the messiness of our healthcare system. Ask for my help and advice, and decide how to live and how to die. Now let's step back and consider our situation for a moment. We see the need for change. Happily, a substantial portion of American people are calling for limitation of government and restoration of liberty. Nowhere are such changes more urgently necessary than in our nation's approach to healthcare. We are finally coming to realize that our government's obligations in healthcare are economically Herculean and will destroy our nation if they are not severely reduced and definitively limited or eliminated. Furthermore, our government's interference in our individual and collective pursuits of healthcare has been detrimental, and through the 2010 federal legislative efforts, also known as Obamacare, well on its way to completely intolerable. Many of us want to limit our government's obligations in healthcare, which is a difficult challenge. We cannot cancel or even significantly curtail our government entitlement programs such as Medicare and Medicaid without abandoning those who depend on them or are planning to depend on them soon. However, our present and impending economic difficulties do not allow us to continue these programs in anything like their present form. The need to budget our healthcare expenditures, like everything else on which our government spends money, is a strong argument for transition from a defined benefit to a defined contribution model. Our current programs involve a defined benefit, a commitment by government to pay for healthcare, whatever the cost, and this approach has proven itself untenable. A defined contribution method would allow us to set limits on the government's financial obligations in healthcare, and therefore make it accessible to budgeting. Many of us also want to restore liberty in healthcare, another difficult challenge. It's legitimate and expected in any endeavor that the person or entity paying the bills will be the final decision maker about how the money is spent. We are therefore not surprised that government funding is accompanied by government interference, even in healthcare. Additionally, since government now pays more than half the bills for medical care in our country and also exercises expansive regulatory and taxation powers, its influence dominates the industry. Even those who receive no government support for healthcare are subject to government's rules and restrictions. So, if we want autonomy in our personal healthcare decision-making, we must surrender our claims and expectations for open-ended financial support from our government. Allow me to emphasize the notion open-ended as opposed to limited. If we expect support for healthcare regardless of the cost, we must also expect the bill payers to be involved with our decisions in their necessary efforts to control those costs. However, if we are willing to accept support which is limited to a predetermined monetary value, we can exclude government from any other role. Costs to the government would be controlled by a budget in this situation rather than by directing our medical decisions. It seems to me that most of us want our government to continue to redistribute funds from taxpayers to the needy for medical care. Preservation of liberty requires that we be ever vigilant to ensure that any healthcare support provided by us and to us through government agencies is not associated with undue influence by those agencies. The value of liberty is another strong argument in favor of a defined contribution approach over the defined benefit approach. Establishing the government's obligations within bounds The defined contribution approach is the only way we can also limit the government's interference with our healthcare decisions. Now, there are still some among us who want to continue down our current road, including continued and increasing reliance on government-sponsored defined benefit programs with efforts to control spiraling costs by redefinition of those benefits, by government agencies of course, to exclude expensive and unnecessary medical evaluations, treatments, and services where expensive and unnecessary are qualities determined by those agencies, restriction of reimbursements to healthcare providers, and regulation of the lifestyle choices of beneficiaries. So what do we do? There is a solution.